Okay, ladies, we're live.
Hello.
Right.
Hi,
Hi.
Arpita.
So I'm Sana Kadar, and I would like to welcome all of you here to celebrate the Menstrual Hygiene and Health Day, I hosted by Inspiring Indian Women. And I'm really grateful for them to give us this platform where we can speak about such an important topic. I'd like to welcome my guests. This whole thing is hosted by Harpreet Chauhan, who is a part of British Army, and myself, Harpreet. Do you want to wave?
Hello. Nice to meet everyone.
Right. And our guest of honors is Dr. Manju Lodha. She's an author, a poet, founder, and president of Lodha Foundation. And the speakers will be myself. I'm a biomedical scientist. I research in cervical cancer. And in 2014, I was diagnosed with endometriosis. Since then, it has become a passion and an obsession, I think, to create awareness in women's health, especially related to endometriosis and other conditions. We also have Professor Arpita, who is a member of the Royal College of Obstetrics and Gynecology. She's a lead clinician at Bourne Hall, Colchester. And she has done a lot of research on polycystic ovary syndrome and unexplained fertility. She's worked with Professor Roy Holmberg, one of the figures in the reproductive medicine and IVF, which is again very important when it comes to menstrual health. Then we have Ms. Rajni Shah, who is an educationist and social activist. We have Ms. Alka Pandey, who is a dietitian, nutrition. She works in nutrition for girls of the age where they go through hormonal changes and iron deficiencies become more evident. So thank you all for joining. We will start now. May I please request if you turn off your mics, if you're not speaking, to avoid background noise. And if there is anything you would like to add, you can put in the comments and we can take it from there. So menstrual health hygiene is very essential for women well-being and empowerment. At any one point, 300 million girls, women, menstruators are menstruating in a day. And out of those, 500 million people do not have access to clean and hygienic menstrual products. So we are here, and I'm going to throw some questions, and either we can go one by one, or you guys can just raise hand or unmute yourself and speak. So my first question would be, in your opinion, why is menstrual health very important? Shall we start with Dr. Arpita?
Yeah, that's fine. Hello. Thank you very much for inviting me to join this forum. Now, menstrual health, why it's so important? Because obviously it's when the menstruation happens, the way it happens that every month when a period starts, that means your body is shedding the lining of the womb, which was otherwise prepared for a pregnancy, right? So, and then your body will start building up a group of eggs through which a lead egg will take the lead in that month. You will ovulate. If that woman is having sex, then there is a potential of having a pregnancy, and your lining is ready for that. And that's how our reproductive cycle or the physiology of the body work. So when a girl child essentially starts having her period, it is important that child has been taught about the importance why she is having that period. It's a shock. It can be a shock for a little girl who is probably 9, 10, 11, suddenly having bleeding. And also, if you do not look after or tell them what are the risks, if they're not using a proper sanitary product, they're using dirty towels, it causes infection. And those infections can affect the lining of the womb in the long term. So they might face problem when they are grown up and when they are actually ready to start family. At the same time, there are a lot of taboos. And you probably know in our previous generations, like moms or their grandmas, they were not allowed to do certain things when they're having their period. And still some areas in some parts of India, like women are not allowed to come inside the house, and they have to live in a separate, like sort of mud house or something, and that's completely unhygienic. So that's why it's important that people have awareness about menstrual hygiene. We should talk about it and make that awareness.
Thank you so much. Shall we move on to Ms. Rajni, because you're an educationist. So how would you think it is important in terms of educating people?
Hello, everyone. Since I'm menstruating now, it's my second day. So on this occasion, I would like to say that being an educationist, I have seen that many of my students are getting their periods very early. Like we used to have our periods at the age of 13 or after 12, 13, 14 years. But now I have seen that young girls like 9 or 8 or 10 years, they are starting menstruating. So it is very, very important for them to understand the hygiene, because they are kids, right? So it is very, very important for them to understand that you should keep clean your areas, like your private parts, so that you can avoid diseases. Okay. And being an educationist, I also think that it is very important to introduce it in our school chapters also, because menstruating and all the problems related to menstruation and all the concept should be cleared for the teenagers to avoid diseases. So as an educationist, I'm trying to educate my children, especially the girls, and even to the boys also, so that they should understand the problems that every girl has to menstruate every month, and it is normal, and they should not make fun of it. And girls should understand that their cleanliness and hygiene should be maintained, so that they can avoid diseases and they can lead a healthy life.
Thank you, Ms. Rajni. And now we'll move on to Ms. Alka. As you're a dietitian, and again, you know, when you're losing that much blood, you are losing a lot of nutrients and it makes you weak. So how would you think that menstrual hygiene and health is very important in terms of, you know, when it comes to people's diet when they're menstruating and throughout the month as well?
Yeah, I think, thank you for inviting me here. And I would like to thank Inspiring Indian Women for inviting me. Well, I wanted to get involved because this is a very important stage of life in the lifespan of a woman. This is the stage where we reach puberty, we are growing, we are, you know, there's so many changes happening in our body. As my previous two speakers have said, that it is a very important part. The body is changing physically. It's changing physiologically. There is so much of pressure, you know, from, as Dr. Arpita Ray said before, that, you know, things used to happen before. Things are changing, but are we there yet? And it is still a taboo. People are still kind of struggling due to various reasons. It could be financial, it could be peer pressure, it could be you know, the environmental factors at home. You never know what a girl could be struggling with. So as we need to normalize this as much as possible. Now, the periods are very personalized to every girl and every woman. It is very different for everyone. One cannot say the same for other. So when they are growing and they're having their periods, if suppose they are having a lot of menstruation or excess period or excess shedding of the lining, then they can also, because they're at a growing age, their dietary needs are very different and more increased in that stage. If they're losing a lot of blood, they kind of they are predisposed to developing iron deficiency anemia if they don't take care of it at the right time. But by the time they are grown up 2 or 3 years later, attain puberty, and sometimes iron deficiency anemia can manifest itself in form of excess bleeding or, very little bleeding. And I don't know, someone, did you say someone is, I'm sorry, I didn't catch the name, but someone is an expert in PCOD here. And, those kind of dietary deficiencies can lead to, or, have a ripple effect on many other factors. So fertility, pregnancy, and a lot of stuff. And these kind of reserves, because they are not there at the right time, when they are pregnant in future, that can also be affected. So diet plays a very important role. Hygiene is very important, and so is diet. Yeah, what I would like to add is, what I would like to add is maybe later on I can talk a little more about diet and what needs to be included and stuff, if anyone.
I do have a question on it, so we will come back to it.
Sure.
So, I believe that, when it comes to hygiene, there are a lot of companies that are sort of promoting their vaginal washes and all that, which can be harmful as well, because they can be disturbing the natural flora of your vaginal area, your genitals, which can lead to more infections, because if it's not the correct flora and correct pH levels, then it would definitely affect more infections. We have Harpreet here from the British Army, who actually did share with me how she was anemic at one point. And, we will come back to you, Harpreet, and we'll listen to your side of story once we reach that question. Mm-hmm. So we do. I would like to ask you all that how would you enlighten us with some reasons that could be attributing to poor menstrual health? Is it something in particular that causes poor hygiene of certain socioeconomic groups, or why is it happening? So if you would like to talk about something.
Shall I
yes,
start
please.
with a few
Yes.
pointers? Yeah. So I think if we are talking about worldwide population anemia and or anemia due to menstrual hygiene practices are more common in the developing countries or the countries below the poverty line. So it's more common in sub-Saharan Africa and South Asia. And what I can think of is common reasons for it could be access to water, access to toilets, and like a place to kind of have dignity and follow the menstrual hygiene practices. Financial situations, if they are, that kind of affects a lot. Which parent wouldn't want their child to have the best of the resources for these kind of practices? But yes, I mean, sometimes it's beyond their control. So, economic situation could be one. And the other could be regional or cultural beliefs. Some people go along with that and don't want to change. Or some people, it is a generation gap, and probably we as the generation going forward and need to teach our younger generation and to bridge the gap between the elderly generation and this generation. The generation now is becoming much more aware, and it is the responsibility for people to kind of teach and take the resources ahead and make the best possible resources available to the people living below the poverty line.
Thank you. Shall we move to Dr. Arpita, please?
I will just take a little time, Arpita, because we have our guest of honors, Mrs. Manju Lodha here. I'll just put her on spotlight there. Namaskar to you, Manju ji. Thank you so much for joining us. And Sana Kadar, could you please introduce her?
Thank you, Rashmi ji.
Yes, so we have our guest of honor, Mrs. Manju Lodha, who is actually the founder and president of Lodha Foundation, is a very well-renowned author and poet, and has done a lot of work in philanthropy as well. So would you like to say a few words on Menstrual Health and Hygiene Day, please? Thank you.
आपको मंच को प्रणाम करती हूँ और आप सबको मेरा नमस्कार और रश्मि जी का विशेष धन्यवाद करती हूँ कि इस मंच से जोड़ा, और आज की ये जो मुख्य समस्या है, गंभीर समस्या है, इसका आपने एक जूम पे एक टॉक रखा, ये बहुत अच्छी बात है क्योंकि इस पर बातें बहुत कम होती हैं। हम बचपन से देखते आ रहे हैं कि हमारे घरों में भी हमने जब देखा कि जब भी लड़की माहवारी में होती है, मासिक धर्म भी इसे कहते हैं, तो बड़ी संकुचित हो जाती है, एक अलग कोने में बैठ जाती है कि अचानक उसे क्या हो गया है। लेकिन हर साल पिछले 2014 से ये हम वर्ष में एक दिवस इंटरनेशनल दिन मनाते हैं मासिक धर्म का, ताकि लोगों को जानकारी हो। और सबसे बड़ी जरूरत है कि हम महिलाएं तो इसके बारे में जानती हैं, लेकिन पुरुष वर्ग को इसके बारे में जानना बहुत जरूरी है कि ये 3 दिन महीने में ऐसे आते हैं जब महिला एक अलग तरह के दौर से गुजरती है। उस समय हमें उनकी जो मानसिक स्थिति है उसको समझना बहुत जरूरी है। मैं आपको एक सच्ची घटना सुनाती हूँ। देखिए, जब जानकारी नहीं होती है तो क्या हो जाता है कि एक लड़की थी जो कि मासिक धर्म में हुई, और जब उसके कपड़ों पे वो दाग दिख गया तो उसके भाई को इस बारे में पता नहीं था। उसके भाई ने जब ये देखा तो उसका सीधा सीधा अर्थ क्या जोड़ दिया कि उसने किसी के साथ यौन संबंध कर लिए होंगे, और घर में उसको इतना प्रताड़ित किया जाने लगा कि अंत में उस लड़की की जान चली गई। आप देखिए कि इसकी, और ये सच्ची घटनाएं मैं आपको बता देती हूँ कि इस तरह की घटनाएं होती हैं हमारे देश में, जहां इसका सीधा सीधा अर्थ वहीं से जोड़ा जाता है। इसलिए इस मासिक धर्म के बारे में लड़कियों के साथ साथ जो घर के भाई हैं, जो पिता हैं, उन सबको भी इस बारे में पता होना चाहिए। और आजकल तो कई बार अभी इस टैबू से हम निकल रहे हैं धीरे धीरे। आजकल तो जब बेटों, जैसे कि कहीं किसी के बेटे ही हैं, बेटियां नहीं है, अगर माँ उस समय पीरियड्स में है, उसका पेट दर्द कर रहा है, वो किसको कहेगी? तो वो अपने बेटे को ही कहेगी कि भाई मैं इस तकलीफ से गुजर रही हूँ, तुम जरा गर्म पानी की थैली बना कर ले आओ। तो इस तरह के हमें जानकारी, और देखिए वो जमाने में कि हम कभी अपने पिता से बारे में बात नहीं कर सकते थे, लेकिन आज हमारी पोतियां हैं जो अपने मेरे जैसे बेटों से वो बात कर सकती हैं, क्योंकि जमाना धीरे धीरे इतना बदल रहा है। और इस समय जो इनको बच्चों को जिस तरह की स्वच्छता रखनी चाहिए उसके बारे में जानकारी बहुत देना जरूरी है। हम जैसे कि जो महानगरों में रहते हैं उन्हें तो सब पता है, लेकिन जो गांवों में रहती हैं, विशेषकर उन लड़कियों को इस बारे में बताना बहुत जरूरी है कि इस समय किस तरह की स्वच्छता रखनी चाहिए, अन्यथा वो किस बीमारी की तरफ बढ़ रही हैं। और आजकल तो हम देखते हैं कि अक्षय कुमार जैसे हीरो जब इसका वो कर रहे हैं तो ये जानकारी जगह जगह पहुंच रही है, वो पीरियड पैड के बारे में बता रहे हैं, कर रहे हैं, तो ये बहुत बड़ा बदलाव समाज में आया है। इसके अलावा मैं आपको एक और घटना सुनाना चाहती हूँ कि एक लड़की जो होती है, घर में है, माता है, पिता है, एक बेटी है। अच्छा, वो पीरियड्स में पहली बार होती है, अब वो किसी से कह नहीं पाती क्योंकि घर में इतना खुला वातावरण नहीं था। तो वो अपनी सहेलियों से कहती है कि देखो, अगर किसी को इस तरह का खून दिखे, अगर किसी को, तो क्या करना चाहिए। तो सहेलियां भी जानती नहीं थी। वो उन्होंने क्या बोला उसे कि कल तुम उस पेड़ पे चढ़ी थी ना, उस पेड़ पे भूत रहता था, उस भूत ने तुमको बीमार कर दिया और तुम जल्दी से तुम मर जाओगी। अब वो लड़की के अंदर इतना भय बैठ गया कि मैं मर जाऊंगी, और वो घर में, जैसे कि वो इतनी बेफिक्र लड़की थी, लेकिन अभी धीरे धीरे वो एकदम सहमी सहमी सी रहने लगी। फिर एक दिन माता ने उसको पूछा कि बेटा क्या हुआ, तुम ऐसी सहमी सहमी सी क्यों रह रही हो? तब बोला, मम्मी मम्मी मैं तो बहुत जल्दी मरने वाली हूँ, मेरे साथ ये हो रहा है, मेरे शरीर से खून निकल रहा है। तब उसकी माँ समझी कि अरे, मेरी बेटी तो पहली बार मासिक धर्म में हुई और मैंने अभी तक उससे इस बारे में बातचीत नहीं की। तब उसने बेटी को समझाया और तब बेटी समझी। तो आप देखिए कि जानकारी नहीं होने से कितना कुछ फर्क पड़ जाता है, लोगों के जीवन तक पर आ जाता है। लोग मरना चाहते हैं कि मैं मर जाऊंगी, मुझे ऐसी बीमारी हो गई है, और जो हम सोचते हैं हमारी मेंटल स्थिति तब कहां से कहां क्रोमा में चली जाती है। तो इस तरह की जानकारी देना हमारे मतलब बहुत जरूरी है, उद्देश्य है। और रश्मि जी, आज आपने ये बहुत सुंदर काम किया है, इसके लिए मैं और जितनी भी यहाँ इस मंच से महिलाएं जुड़ी हैं वो निरंतर इस बारे में काम कर रही हैं। हम भी ये काम इस तरह का कर रहे हैं। लोगों, हम मशीन लगवा रहे हैं, मशीन में जैसे पैड लड़कियों को निःशुल्क उपलब्ध हो जाएं, और उस पैड को भी किस तरह से उसको डिस्ट्रॉय करना है उसकी भी मशीन जैसे लगाई जाती है, वो भी बहुत जरूरी है। क्योंकि हमको वातावरण को भी स्वच्छ रखना है, पर्यावरण को भी स्वच्छ रखना है। तो सब तरह की चीजें करते हुए, और हम महिलाएं इसमें विशेषकर आगे आएंगी, तो एक दूसरे का हाथ जब हम पकड़ेंगी तो निसंदेह हम कुछ भी काम करके दिखा सकती हैं। यही मैं आपसे कहना चाहती हूँ सना जी और रश्मि जी।
Thank you so much, Manju Lodha ji. Whatever you just said has sort of summarized everything that I was going to ask. I should have actually asked you to speak right at the end then, because it sort of summarized everything. But thank you so much. We do have such incidences all over the world where women are ridiculed for having periods. They are considered untouchables for having periods. They are sent away. They're not treated like the first-class citizens of any country they live in, especially in this, as Alka ji earlier mentioned, in the developing countries, whether it's in Africa or South Asia.
हम उसको एक अच्छी तरह घर में रखना चाहते हैं। मैं आपको एक बताती हूँ कि मेरी जो पोती है, मतलब जब 13 साल की हुई, फर्स्ट टाइम पीरियड्स में हुई, तब मैं इससे ऐसे ही बातचीत कर रही थी कि बेटा, जैसे हम बोलते हैं ना, मंदिर में नहीं जाना है या कुछ नहीं करना है, तो बोली दादी, वो मेरे से बहस करने लगी, दादी ऐसा क्यों होता है, क्यों लड़कियों के साथ ये सब होता है कि वो मंदिर में नहीं जा सकती, वहां नहीं जा सकती। और उस 13 साल की उम्र में उसने 5 तरह के हेल्थ प्रोडक्ट शुरू किए कि महिलाएं इस दौरान उस प्रोडक्ट को खाएं ताकि उसको कम पीड़ा हो। 13 साल की लड़की ने वो शुरुआत किया, क्योंकि उसको ये बात लगी कि हम लड़कियों को क्यों इस तरह से कहा जाता है कि तुम ये नहीं करोगी, किचन में नहीं जाओगी। इस तरह के जब हमारे घर में सब ये होता है, जब हमारे जमाने में आज से जैसे कि हम लोग 60 साल पहले, तो हमको एक कमरे में अलग ही कहा जाता था कि वहां बैठो, और हमें सोने को बेड भी नहीं मिलता था, हमें सिर्फ एक चद्दर दे दी जाती थी कि आपको उस पर सोना है। देखिए, तो लेकिन अभी इतना बदलाव आया है कि अब लड़कियां घर में बेड पर भी सोती हैं, सब काम पर भी जा रही हैं, सब कुछ कर रही हैं। तो ये बदलाव, बहुत अच्छा बदलाव आ रहा है, और इस बदलाव की आवश्यकता है, और ये बदलाव हो रहा है। और इस तरह के जब इंटरनेशनल डे बनाते हैं तो इसका बदलाव और भी आता है, इसका असर पड़ता है।
Thank you. Yes, and it's a shame that, in the past when women were put in huts, in some places it's still happening, when they need all the comfort, of a bed, of a comfortable bed, of a warm place, they were just left on their own to suffer alone. Now, heading back towards our question on, what could be the health conditions that could be associated with menstrual hygiene due to poor menstrual hygiene. We'll come to Dr. Arpita Ray to, answer that.
As I said earlier, main issues could be the infection, which can have not sexually transmitted infection, but general infection of the vagina, which can then spread inside the uterus, and that is called endometritis. Or because of the lack of nutrition, can have tuberculosis, because at that time you are like, you should not have this, you should not have those. So therefore they are becoming nutritionally deficient, they are becoming anemic, and therefore they're more prone to general poor health conditions. And tuberculosis endometritis is very common within Asian women, especially Indian, the women, those who are coming from Indian subcontinents. And in the fertility practice, we do see those things when someone is doing the practice in India. I practiced IVF in UK, so therefore we don't see that many from the local population, but within the Asian women or people from Indian subcontinents, we do time to time see those scenarios. So it is important that people should be aware of that, and those taboos, you should not be going inside a temple, you should not be doing something religious. And I think we need to look at our own religion. If you think about Kamakha temple, where Mother Kamakha is worshipped, and there is a big festival when she is actually supposed to be menstruating, because the river at that time, probably for some geographical reason, turned red. But it is kind of told that mother is menstruating, and it's a big festival. So if our religion is celebrating menstruation and that part of female life, we should not be stopping any woman taking part at the time of puja. Why? Because this menstruation is ensuring that it could be a mother. And we say motherhood is the best gift of a woman's life. So I think awareness, talking openly to your girl child, to your boy child, and talking about the physiology, putting it into the school curriculum, and making sure this is a normal process of a woman's life. It's nothing that you have done anything wrong. You should be proud. If you do not have period, then you should seek help from the doctor, because there could be various reasons why someone is not having a period, and that can have serious implication in their life later on.
Right. Thank you so much. What you just mentioned about the religious aspect of the menstruation, I grew up in a Muslim household, and growing up, we were taught that, although I come from a liberal background, but we were taught that, you're not allowed to fast, you're not allowed to pray, you're not allowed to touch any religious scriptures because you're impure, you're dirty. And at that point, when I was growing up and I had my first period, I was very concerned that what if I wanted to ask God for something? What if I am having an exam and I wanted to pray? And, I was told I can't do any of it. But, my father was very liberal, and he said, what he taught me was that the reason why you're not supposed to pray or fast is because God is allowing you that comfort. It's not because you are impure. That's a very worldly thing. In religion, it's not forbidden, it's stopped, because God doesn't want you to not eat when you're menstruating, because how important diet is, how important water is, especially in hot countries. So we have sort of manipulated the religion, I believe, where it is focusing on men, and women end up suffering, and we're not supposed to do certain things. But we also touched about educating. So we'll come back to Rajni Shah for that, because again, as I said, there are a lot of hygiene issues. And earlier Manju Lodha ji spoke about how a girl went to her friend and she said, you have you're there is a ghost who's following you. So how would you tackle that issue? Because I think it's very important to break this kind of taboos where all kind of weird stories come up.
Actually, I tried from myself to spread this message to all my near and dear ones, that period is not a problem. It is a proud moment for us because we can become mother. Okay, so but as we stay in a society, in a so-called society, and people like older than us always used to say that while you are menstruating, you are not allowed to do any religious rites, or you are not allowed to do anything, because I think there is a science behind it, because see, any religion doesn't bar you for doing all these things, but the thing is that it's the time when our body needs rest. So it is said that you have to stay in a resting position, but people have made it in such a way that you can't go anywhere, you can't touch anything, you can't perform any rituals. So blah blah blah, all these things are going on. And I think this somehow it has means the things have changed, but there are still many things that is going on in our society. As I belong to the northeastern part of India, so people here celebrates their girl's first menstruation period. When a girl is having period, their family used to celebrate. They used to have feast. They used to call all their relatives, close people, and near and dear ones, and they used to celebrate. It's a big feast. Again, those girls, when they will have period every month, they are asked to stay alone. They will be given a separate bed. They will be said that you can't touch, you can't go to the kitchen, you can't do anything, you don't touch us, you don't touch the clothes, everything. So she is kept separated. So the basic thing is that the education, the knowledge behind the period is somewhere lacking in our society. So being an educator, see, I'm a tutor, so I can only reach to some students whom I'm teaching by going to their home. But I have already written letters to the health ministers also, that I have sent email that we should have a chapter on it, because it is very, very important. In class 9, adolescence is a chapter. Puberty is a part of it. But puberty, why girls are having puberty, what is the circumstances after having puberty, what are the conditions they are facing. So this thing should be explained in a proper way, and it should not omit from the syllabus. It should be a part of the syllabus, because then only the children will learn. And here both girl and boys need to learn the things, because then only we can create a healthy society. So it is a very, very, very important for us to educate both girl and boy about the periods and what a girl is going through at that time. We all go through this tough time, because these 3-4 days we are bleeding, we have mood swings, we have pain, we have so many things. Apart from that, we have to perform our duty every day. Today is my second day, still I have to go to my tuitions, because tomorrow my students are having exam. I am having pain in my body. So I am blessed that I belong to a family where my parents doesn't allow me to sit alone or use a different bed, or I just don't perform the rituals. Otherwise, I am allowed to do everything. Like me, many girls are there who have to travel every day to their work, and they don't get leave for periods. So I think the education is important, because see, we have to wear pads for a longer time. Sometimes we have, I only have to use it for approximately for 12 hours. So during that time, the things which is in our body, which is attached in our body, we have to go through rashes, we have to go through so many things, but we have to carry on. So there should be a solution for this problem, that even we wear pads, we should have a proper place where we can go and change our pads, or we can go and ask for someone to help us during this time. So these things should be relevant in our society. People should understand that a girl is bleeding and it is natural and she will have, but this is also a time when she needs help, or she needs mental support. So these things should be done through textbooks. I think this should be done through textbooks, and people should understand that this is an important topic and everyone should talk about it. And one thing I have seen that when I was young, my parents used to bring the sanitary pads wrapped in a newspaper. But I have broken that taboo. I used to bring it directly. Yes, I have periods, and that's okay. Every girl used to have. And without period, we are incomplete, because we have to give birth. So when we are giving birth, when we have got the privilege of giving birth, so what is the shame of having period? So that I have done. I used to bring the sanitary pad directly from the shop, and I asked my shopkeeper, don't wrap it in a newspaper. It's okay. So I have seen that, like me, many girls are now changing, and they are bringing their sanitary pads directly from the shop. So I feel happy that I have started and many girls are following it. So in this way, if together we will work, someday we will have a great solution for this problem also.
Thank you so much. Yes, I agree. I'm talking about 15 years ago. I did the same, I was in a supermarket and I just threw the sanitary napkins in the trolley, and everyone was just looking at me as if I was an alien. And you know what you said, that about women going to work and having to work. I used to play squash internationally, and I still had my matches on the first day where, you have to do all the stretches and everything, and it's quite hard. So moving on from there, I would like to ask Harpreet, who is a part of British Army. She's a reservist and an ICU nurse as well in British Army. So I would like her to share her experience, because there was a question as well I just read in comments about how to delay periods, and she has her own journey of anemia as well. So if she could speak and shed some light on it.
Yeah, sure. I was reading the same question, Sana, so which leads on very nicely to my story. So basically, I am in the military. I have served in the army for 13 years. And being in the army, obviously, one of the important parts is that you have to live out in the field. If you are deployed, you are, the facilities are limited, the resources are limited. So the question comes, how do you look after yourself? How you look after your menstrual health? I think I am lucky that I'm part of an organization where resources aren't limited. So when we get deployed, we still have access to toiletry facilities. There are portable loos, even if we are living out in the field. But coming on to the question someone's asked, that how can we delay the period? So this is one of the things we do. So if a female is about to get deployed, we can be away for 3 months to 6 months. There are certain medications you can take if you want to delay your period. I will let Dr. Ray explain the side effects and everything, but what I personally want to mention is, you know, some women, they go through very heavy flow and they struggle. And I think a lot of women in the military, we have to regularly exercise, and we do high impact exercise as well. And when you're on your period, it's definitely very difficult. You know, all the tiredness that comes in, lethargy that comes in when you are menstruating. So I personally prefer the use of IUD, which is an intrauterine device. There are coils as well, so which can reduce the flow. It helps to reduce the flow of your period. But I'm going to come to Dr. Arpita Ray. If you could please explain our audience and the listeners and tell us what other measures are available if one wants to delay their period, or if they do go for that option, what are the effects of that?
All right. Many thanks, Harpreet, for asking that question. I think we all have done like sort of a short-term delaying of the period just before exam, or you are going for a marriage or something where you want to have fun and you don't have to bother about having the period, etc. There are short-term measures like you can take some tablets. We do prescribe in our fertility practice as well for scheduling their period. And that's like progesterone tablets. It's called Provera or norethisterone tablets. And I don't know what are the names, trade name in India, but in UK, they are called Provera and Primolute N. So we give those for 5 to 7 days. And there are two types of progesterone. Medroxyprogesterone is kind of, which does not give you more side effects, whereas norethisterone gives you, they're equally effective, but different version suits different people. Some might say like, yeah, norethisterone is better for me, or some might say Provera is better for me. So the side effects, the temporary side effects of delaying the period, you might get, you need to take those tablets normally like 3 times daily or 2 times daily for 5 to 7 days, or as long as you want to delay your period. But the side effects you get because of those progesterone is like, you might feel very bloated. That's because of the water retention, or you might feel tired, lethargic. These are the common side effects of those tablets. However, sometimes because of certain medical condition, as you mentioned, that some people may have very heavy period, for which obviously the delaying period, because of the very heavy bleed, they might feel very tired, exhausted. Their quality of life is getting affected. Lot of time, what we do as a gynecologist or the GPs, they put them on the pills, right? And these pills, not like just for birth control, but for symptom control for heavy period. And these are like back-to-back pills packet, or back-to-back progesterone, like for 3 weeks, you take the pills and then you roll into another cycle, so that you can delay your period as long as you want. However, when Harpreet talked about intrauterine devices, there are 2 types of devices. One is copper IUD, other one is called hormone releasing intrauterine system, which is known as Mirena IUS. Now, copper intrauterine device will actually cause heavy period. It will give only birth control, whereas Mirena IUS releases tiny amount of progesterone daily, and therefore you will get less heavy period. The way it works, that it will give you birth control, and also 30% of the women will experience that their period has completely stopped or no period at all. Some will, another 30% will have erratic mild spotting. Another 30 to 40% might feel that there is no change. But if it works for you, then it's good. Similarly, other contraceptive methods like every 3-monthly progesterone injection, progesterone patches, which are used as a contraception, can also reduce the menstrual flow, because it's the general progesterone effect on your body which helps. However, when you are using this progesterone or this tablets for a long time, and you are continuing with the high impact energy like long distance runners or ballet dancers or gymnasts or marathon runners or professional athletes, what sometimes can happen, it can suppress their ovulatory function. Their ovulation may not happen. To start with, it might all work well, but in the long run, what we sometimes see, they do suffer from subfertility. I'm not against it, but that may be the long-term impact of it if you are on these medication or measures for a long time. A small proportion of people may have that kind of side effects, but it has to be your life's choice, your priority, and then you can make those decisions after being fully aware of pros and cons of each type of treatment.
Thank you very much, Dr. A. That was really insightful. I would like to mention those listening, because obviously we have audience from all around, I guess, globally, and the rules are different in different countries. Some of us are based in UK and we have a different system here. So those listening from India, please be aware that you consult your doctor if you want to take any of those treatments. Get all of the information before and then make your decision. Always make an informed choice. I'm very wary of the timings, and moving on, can I please take this second question as well? There's a question someone highlighting in the chat. There are women who don't want to wish to become a mother, and limiting this and making it something which is proud mothers only exempts women who do not wish to become a mother or who cannot become a mother or for whatever reason. So can we please have an inclusive perspective? Who wants to take this question? I think not everybody wants to become a mother. I think what they're trying to say is that we are highlighting menstruation as, take it positively, that, you know, if this is a sign that you are basically going to become a mother. Those who don't want to, what do you want to say to those?
I'll take this question because I am child-free by choice. I made this decision as a very young person. I chose not to have kids at any point in my life. There were times when people said, oh, you will grow into it, you will want to have kids once you're 35. My answer was very clear to them, that if I ever feel like I need to have a child, I can always adopt. There are so many people on this planet who need a better life. As I mentioned earlier, I have endometriosis, which also affects my mental health, my physical health, my quality of life. And it is, deep infiltrated endometriosis in my pelvic, where all my organs are sort of attached to each other. So I don't think I can take the responsibility of another person coming into this world. And secondly, I don't think I have that in me, the motherly instinct that comes naturally to a lot of women, because that's what they're taught, that, it's your biological destiny to have babies. Not everyone can identify, but in African or in South Asian cultures, a lot of women are pushed into having babies. Sometimes they're not ready. And it is a shame because it's a societal pressure. Like, there's so many jokes that the moment you get married, within a year, you need to produce a baby. Sometimes people are not ready financially, mentally, or whatever. They might want to plan the family. Now it's changing. So yes, it's very important to consider that part as well, that while menstruation actually does tell you that, this is the time of your life from when onwards you can get pregnant, have babies, but not everyone want to identify with it. So leading from that, my next question is actually that when we hit menopause, there's not much education about it. Not a lot of women know once they're hitting menopause, what are the side effects, what are the symptoms. And, you know, there is a lot of taboo involved around, we spoke, everyone has mentioned this in the past as well, that, you know, there's a lot of taboo revolving around the whole period, women's health. I've been on talks where people have done the talks and then they removed it from their Facebook or whatever social media platform they were using, because either they got threats to remove it because I was talking about women and vagina and whatnot. So, you know, you can't talk about it. So why do we not talk about menstruation, hygiene and health in general? Can you please, mute your mic if you are not a speaker? Thank you. So shall we start with Ms. Rajni, because, you know, again, and then we'll move on to Alka ji.
So you are talking about menopause, right? So
in general, why do we not talk about anything related to periods? Now it's changing, but why it's still a taboo?
We are not talking because, yeah, we are not talking because we are taught not to talk. It is a very private thing. We will have it in a private parts. We will have a vagina, we will have flows, and it is taught us to keep it a secret. So many people, many especially women, as you said, that many people are writing about it in social media, and then they are removing their post in a fear that their in-laws or husband or someone of their family may see the post and may threat them that why they are posting such a sensitive issue in the Facebook. So this is the problem with our society, where women are considered untouched, women are considered impure, and when it comes to the vaginal part, so women are considered that it is a very private thing and it should be kept private. So by keeping it private, our grandmas, our mummies, our all the elder generation, they have suffered a lot. In many families, women are not allowed to speak about their periods in front of their family members, in front of their father, in front of their in-laws, because they are taught that it is a very confidential things and only girls should know about. When you have disease, you have to go to the doctor, right? So we don't go by seeing the gender. There are many people still, for the gynecologist, they always prefer a women gynecologist. No matter how good the man gynecologist is, but always it is preferred that they need a women gynecologist, because they think that it is a women's problem and women only can solve it. What I believe is, when we will not talk about it, the problem will remain same. So talking is important, because my mother has faced a lot of issues in her due to her menstrual hygiene. She used to use clothes. She doesn't use sanitary pads. And later on, at the age of 35, she had a 1.5 kg tumor in her uterus. And after that, she got removed. At the age of 35, her period stopped and lots of things happened to her. And it is just because of that keeping secret. So now it is the time to break the taboo. It is important to educate people. It is important to talk in public that menstrual health is very, very, very important. Now we are lucky that we are getting pads, but what about our parents, our mummies, our grannies? They used to use all those clothes, and that also they have to dry by in the shades, which is another an unhygienic thing, because the cloth is not getting proper sunlight. They have to hide it in between many clothes, and then they have to dry it. When I got my first period, my mother started giving me clothes, and later on I have so many problems, then I stopped and my mother started giving me pads. So now I'm using, but they have faced so many issues, and because of those clothes, they are getting infections in their vaginal part. My mother had her tumor, 1.5 kg tumor in her uterus because of those clothes. So when we will not talk, we will not come out with the problem. So it is very, very important to talk. It is very, very important to speak about it and to educate people. Menopause is another a part of a woman's life after the age of 50. Now women are having early menopause, but previously they used to have menopause after 50. So then they are considered as the burden of the family. No use for men. Why? Because she is not menstruating. She is no more women. She is just considered a burden for the family, for her husband, for her. So these things need to be talked. These things need to be understood, that menopause will happen. Once the period will start at the age of 10 or 12, then after reaching the age of 40 or after reaching the age of 45, women will start menopausing, and it is quite natural. I have seen many of my students' mother, when they are in the menopause stage, they are not accepting it. Even I say that maybe your menopause has started or something like that, they will say, no, 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 my elder sister is still having the periods. My in-laws are having, they are elder than me and they are having periods. So how can I be? Everyone's body is not same. Someone can start their periods at the age of 7 also. One of my friend's cousin got her period at the age of 8. So she will have her menopause early. She may have her menopause early. So there is no shame. So this is a natural flow. This is a natural thing in our body, and everything has their own cycle. It is a period. It is a time. After this, hitting that certain age, a woman will start menopausing, and it's quite natural. So there is no shame. So it is important to talk. And IIW has organized such a beautiful platform that we are talking it on the menstrual hygienic day. And today, I think with this platform, many people will come up with a concept, and many people will come out of the taboo, and it will help many girls to understand what is period, why they are having it, and it is a natural flow, and how to tackle this situation. So thank you so much, Rashmi ji, for giving us this platform and organizing such a beautiful event.
Thank you. A little time. I'll just take a minute. Thank you so much, Rajni. That was very insightful. I want to now thank Mrs. Manju Lodha ji. I'll just add her to the spotlight because she has been doing incredible work in her society and the country and everywhere for women. Woman who has done so much inspiring work, and she needs to leave because her grandchildren are just around her, want to be with her. So we would thank Manju ji for being part of this talk. Thank you so much for joining us. Namaskar.
Thank you, रश्मि जी. इस तरह के आप और भी करते रहें कार्य. हम हमेशा आपके साथ हैं और आपके साथ जुड़े हुए रहेंगे. रश्मि जी, मेरे मन में एक बात आई कि जब पुरुष भी बड़ा होता है, उसकी दाढ़ी मूंछ आती है, तब उनको कुछ भी शर्मिंदगी महसूस नहीं होती है, लेकिन एक महिला जब पीरियड्स में होती है तो क्यों शर्मिंदगी महसूस करे. ये सवाल मेरे मन में रह के उठता है कि क्योंकि बड़े तो दोनों ही हो रहे हैं. वुमन भी जब बड़ी होती है, जैसे कि साउथ में कई घरों में, जैसे कि जब वो बड़ी होती है, पहली बार पीरियड्स में होती है, तो बहुत बड़ा खाना किया जाता है, लोगों को बुलाया जाता है कि अब वो वुमन हुड के लिए तैयार है. तो कई सवाल ऐसे मन में आते रहते हैं, लेकिन इन सवालों के जवाब हम ही को ढूंढने हैं और हम ही को अपनी इन बेटियों को इस टैबू से बाहर निकालना है कि ये तो एक मतलब नेचुरल प्रक्रिया है जीवन की आगे बढ़ने के लिए. तो बहुत बहुत आपका धन्यवाद. और जितने भी स्पीकर हैं, मुझे उनका सुनकर बहुत ज्यादा अच्छा लगा और सबको मैं धन्यवाद करती हूँ, और विशेषकर आपका और वो जो हमारी सूत्रधार है सना जी, उनका भी बहुत बहुत धन्यवाद. थैंक यू वेरी मच.
Right, so we'll move on to Alka ji to talk about why it's not spoken about. Why do we not talk about periods or anything related to it, whether it's the beginning of the periods, living through it, or the menopause?
I think it is a big question. Why do we not speak it? And I think it's communication. It's like keeping under wraps, isn't it? Women think we are superpowers. we need to deal with everything on our own, isn't it? We feel, no, kyun batana, kyun karna? We have to deal with this on our own. It is something that is happening to my body and I need to deal. And I think, going back to these, when the talks are happening now and I'm thinking about it, it wasn't, I think the main reason why these taboos were placed on it had a different reason to it. Like with any other cultural taboos that we might have, there was a scientific basis to it, but it wasn't explained that way. It was always explained in a roundabout religious kind of way, because people understood that language, the scientific language. There was no scientific evidence to it. But now if we go back to it and find out as to the reason why, there is a science behind it. The women were not allowed to go into the kitchen, touch the waters, or do things, because there was no hygiene at that point of, in those early ages. I'm talking like ages and ages ago. That time there was no clean toileting facilities. So there was a lack of water. People in some parts of India used to travel a lot. They had for one pot of water. Imagine if they can't even get water to drink, how much water they will get to keep themselves clean. It was a luxury to have that pot of water. So what was happening was, they used to somehow go through these 3-4 days. They felt unkempt, unclean, and that's why they didn't go into the kitchen, because they didn't want to touch the food. Or, make it kind of, if we go to a scientific basis, they are not getting water to clean their hands and their body. They're probably harboring microorganisms or bacteria or viruses, which we know after COVID, there are contagious ones which can spread. So they didn't want to do that. And there was that, but it wasn't communicated that way. It was always said in terms of religion, in terms of don't do this, don't do that. But I think communication now is a major part of what we should be doing. And the fact that we are having all these talks, the fact that we are having films made on it, the fact that without any, political inclinations or anything, I think the Prime Minister of India, when he started in 2014, 2015, all these, making so many, I think I was hearing his speech today, and there's like crores of toilets being made around all over India. And that has given such a boost. So I think communication is a major part of what we should be doing, learning from the lessons that we have going forward. And the same applies to menopause now. I think menopause is such a hot topic now. No one knew about menopause earlier. People used to say, oh, your periods are going. We see our mothers and grandmothers going through the same thing, and we think the same thing will happen to us. It isn't explained to us that what is happening, why it is happening, what are the side effects. So communication going for the generations forward, for our daughters, for our sisters, for our granddaughters, we need to be there, and we need to explain it with a more scientific language and explain the reasons why. Once we do that, people will understand, and we haven't done that before. So I think communication, listening to them, talking to them, and explaining to them is the road ahead.
Thank you, Alka ji. I think you have touched on a few very important aspects. Like, for example, when we talk about communication, nowadays, if you look at the ads for period products on TV, they are showing red liquid instead of the blue liquid that we have all seen growing up on all those whisper ads and always ads. And I think it's very important, because when I had my period, I was like, why would a blue thing come out of me? And then another thing that you mentioned, that, women think we are these strong people and we don't need to tell anyone. I think it's because it's glamorized, it's romanticized, that, every woman have it. And if you say that you are in pain, I remember I had a friend in my school who couldn't get up from her chair because she was in so much pain. And there will be teachers, there will be other staff who would tell, you're not the only one having period or pain. So it's a shame, we don't actually respect women who, your period and my period might be very different. We all suffer differently. We all manage it differently. Earlier how, Arpita ji and Harpreet were talking about, the delaying the periods. There are other certain issues that we don't talk about, which is osteoporosis, which is very common with menopause. I was, as somebody, as Rajni ji said, that, we don't talk about menopause. I was induced menopause at 24 because of my endometriosis for 4 months. And so I bleed heavily from all three outlets. I cough out blood because endometriosis is in my lungs as well. So it's very hard for me to manage on a daily basis. But the medication that I was given has caused my bone density to go down significantly, that it feels like my bones are cracking. So we don't talk about it openly. And when you start talking about it to anyone, they're like, oh, let's move on to a happy topic. But this is my life. So why do we not talk about it? I'm not sure if Harpreet is there, because she had a follow-up question for you. If not, we'll come back to it. Oh, are you there, Harpreet? Yes, she is.
Sorry, yes. Sorry, I got disturbed by my children. Yes, I have a question regarding diet, please. So during the initial years of my military career, I was very unaware that I have chronic anemia. So obviously, every time we used to do exercise, I always used to go short of breath and sometimes like faint like symptoms. And then I was quite, I didn't have the awareness basically that, what role hemoglobin plays a very big role in women's health. So I wanted to ask Alka ji, if you could just give us some tips very briefly, especially to the listeners, that how can they keep their diet, basically, how can their diet help? And also, how often should one get their HB checked?
Yeah, so I think this is a very good topic. This is a very good question and a very important topic to cover in these kind of, in this phase of life where we are, because as women, we suffer from, periods from right from when it happens to the time we reach menopause, which is a major part of our lives. And if we don't pay attention to our diet, we are not helping ourselves. Like you said, when you have anemia, because there is, less of iron, and iron is carried by hemoglobin, and when that reduces, then there is less of oxygen circulating in your blood. So that's why you feel, kind of out of breath, your shortness. There are dizzy spells. As soon as you stand up, you can get that lightheadedness, that kind of thing. So having iron, obviously, you can check your HbA1c. You can check different components of iron that may be deficient, because it's not just hemoglobin that can be deficient. There's different types of iron, because iron can be, in different forms, like as carriers, as proper iron in there, and that can, which part of iron is deficient determines what sort of anemia you'll have. As regarding testing HbA1c, if you're getting any of these symptoms like excess, diet is not the only factor that can cause anemia. That is one of the factors. It could be very multifactorial. If you're having, like Sana said, if you have endometriosis and you're coughing out blood from different, parts, there is excess bleeding. All that excess bleeding can cause a toll. It is not just during, I have always had heavy periods. So, I used to feel that. And that was the only cause for me. I have never checked whether, when I was small, I didn't check because it never got checked, because that was thought to be, you will have that kind of symptoms while you're having your periods. But yes, I think, do you want me to talk about diet, or
how are we doing with time, Sana?
Rashmi ji, how much time do we have, or are we still okay for time?
See, we have, of course, it's our own world and we have our own Zoom. So it's not something official. We can continue, but I think 20 minutes would be fine if we can continue for 20 minutes.
I won't take much time. I'll just give you some pointers about diet, and that is a starting point as to where we should be taking care of our diet, because, I've got few statistics and it's very startling. It's like 1/3 of the population worldwide is suffering from anemia. That could be because of the diet, that could be because of excess bleeding, that could be because of any, abdominal bleeding, ulcers, or gastroenteritis, IBD, which is getting more and more common in children now because of pressures, because of mental health problems, because of stress and everything. There's a lot of factors. So I think the main thing to think about is, when iron can be had from, it's called as heme sources and non-heme sources. So heme sources are things like protein, red meat, pork, beef. Not many people in India eat that. So it is present also in fish and chicken. You can have that. The quality is very different. So I think the baseline of everything is to have a balanced diet. In terms of Indian context, I would say don't have your teas and coffees with your meals or after your meals, because that spoils the iron absorption in your diet. So any little amounts of iron that you're having in your diet, if you're having tea and coffee around that, the tannins and the caffeine will stop it, will kind of reduce the absorption of iron. So that is one thing to remember. Always take vitamin C with your food, whatever you're having, because vitamin C helps with the absorption. The other contraindication is to not have milk or dairy along with iron-rich foods. So because milk and dairy, calcium and iron compete for absorption. So, if they are competing, calcium gets absorbed and iron doesn't. So that is one thing to remember. And as regards your question of how to get how frequently to get your hemoglobin checked, I think if you notice any symptoms or any abnormal symptoms for you, so it's like you have a normal period every time, but off late, if you have been having a lot of periods, or you're feeling dizzy, you're feeling weak, some people feel very drowsy when they have their periods. So that could be one of the signs. Feeling lightheaded when you get up, that could be one of the signs. So if you feel you're having those kind of symptoms other than your normal, because periods are there is a certain normal for yourself. So if you feel there is something different from that, do get it checked. Especially in the menopause, where as we are nearing the perimenopause and menopausal period, it is really important. And coming back to Sana's point earlier, that taking care of our diet in menopause and building that, you need to have a foundation, right, to be able to build a building on it. So if your foundation isn't right while you're in your menopause years, it's really difficult. The hormones are going down, and that affects your bone, your heart diseases. So yeah, talk about it, learn about it, do research about it. And for diet, come to me.
Thank you so much, Alka ji. I will just add one more thing there, that there is not just iron deficiency anemia, there are other types of anemia as well. So if you think anything is abnormal, not right, go see a doctor, get a blood test done, and look for underlying conditions. It could be anemia, it could be anything else, and then it could lead on to something very significantly problematic as well. So in my opinion, every woman should at least have the blood test done once a year, if not every 6 months. And there are other screenings as well that women should go through, especially if they have histories of cancer, breast cancer. You must go for mammograms, cervical cancer. You must everyone who is sexually active or not active from 24 years onwards, you must have a pap smear done every 3 years. In the UK, they're increasing it to 5 years, which is a shame because that's a long time. But after 40 years, it's every year. So we'll just move on to the next thing. We've spoken a lot about how men should be educated on menstrual health and hygiene. There was a time when men wouldn't want to talk about it. They would think that, you know what, it's disgusting. And I have grown up in that era where, if you just said I'm on my period, they'll just look at you one kind, that, oh, you're too dirty, you're untouchable. So, but when I was growing up, when I had my first period, my dad sat me down, he gave me the sex education, everything that needed to be told. And when my brother, who's 4 years younger than me, when he reached the age, he was taught everything as well. And I have seen him he was younger than me, so obviously we had the tussle, the fight with each other. But now with my younger sister, who's a few years younger than him, he's very compassionate, he displays that emotional intelligence. So I think it's very important for boys to learn to be empathetic towards women in their life, whether they are their mothers, sisters, wives, daughters, or women around them in general. So how, how and when do you think it's appropriate to talk to boys about it and to girls? I do think just like sex education in the UK is becoming compulsory, this should also be part of curriculum, as Rajni Shah has mentioned several times during tonight. Do you want to speak, Ms. Arpita?
Sorry, didn't realize the question was directed to me. Sorry, I was waiting for Rajni to respond there.
No, it's for everyone. So I just, you can start and then we'll go on to Rajni.
Oh, okay. Yeah. Thank you for asking that question, because sex education is really important, and to be aware of not only about your own body, its changes, but also the other genders, the changes they do go through. Because the women probably go through more changes than the boys, or women's changes does have impact on their social life because of historical gender discrimination, or like women are the weaker sex and those kind of myth. So I think we talk about, if you look at education, what we teach in different countries, we talk about contraception a lot. We talk about avoiding sexually transmitted disease or STDs a lot, but we do not talk much about fertility awareness or changes in the body. Because I'm a mother of a 21-year-old, and I remember when he was at school in UK, we got a big email from the school, look, we are going to go through sex education in the primary school, so therefore we just want the parents to be aware. So being a gynecologist, I sat down with him and said, look, probably you are just going to see certain things, it might come to you as a shock, etc., etc. And I explained everything, the female body changes, male body changes, how the babies are made, etc. He comes back, 9 years old. He said, you have told me all sorts of things, and they just told me there is a bee, there is a flower, and there is a baby. And I said, okay, if the school curriculum is teaching you that, I think trust your mother. Your mother has actually told you the facts of science. But I think there is a lot of taboos about talking about all those things within the family. If you go into Europe, I think the European people talks much more openly. UK has probably more or less similar mindset what we experience in India, but things are changing. So I see more and more younger women or men, they comes up with not with their problem, they just want to know the facts of their bodies. If I am okay, if I have a symptom, I go to which person? But I think there is lots of awareness needed within our GP system in UK, because if you think about endometriosis, it is like we are seeing just the tip of the iceberg. And in UK, being NHS having endometriosis awareness, there is a charity for endometriosis society, etc., etc. On an average, a woman needs almost 5 to 7 years to have that diagnosis of endometriosis. And it's a horrible disease, but people don't talk about it. So I think from the medical profession wise as well, it needs a lot of education, and to take a patient's symptom seriously. Lot of time the patients will come because they know their body. They will say, I think, yes, we always say Dr. Google is not the great thing, but sometimes Dr. Google give you the hint which help you to challenge your doctor or your gynecologist. Have you thought of that? Because I'm not saying everybody to be paranoid about their symptoms, but I think developing awareness is the most important thing, and talking openly about those problems.
Thank you. I think it's very important. It resonates very well with me because I have this platform on social media. And today is actually the 3rd anniversary of the group that I have created where women come with endometriosis and this kind of condition. I do tell them that, before you go and see a doctor, ask, search about it and write all the questions you want to ask, because sometimes you're just dismissed. I have been to doctors where I've been told, oh, I don't want to open a can of worms because you're bleeding from all 3 passages. And it was an endometriosis specialist in the UK. My GP thought endometriosis doesn't go above the diaphragm. And when I told him it did, he was like, oh, really? I didn't know that. My endometriosis nurse told me that a certain injection that was given to me does not affect my breast. And 6 months later, when I went back, she said, oh, I actually read up on it and it does. And I'm like, recently, I was given a medication that you're not supposed to give when somebody has Mirena coil inserted in them because it does not work well. And I was given that. So there's so much of, lack of understanding, lack of funding, research available around women's health in general. And then we don't talk about it because it's, again, a big, big taboo. So we'll come to Rajni and we'll talk about the question that was that at what age do you think it is important to talk to boys and why? Because that was one of the questions as well in the comments.
Sorry, I didn't get the question actually.
Sorry, the question is that at what age is it important to speak to boys? And why is it important for them to know about menstrual hygiene and health? Because you're an educationist, so you would know better.
So what I do is when a boy reaches the age of 12 years, I speak to them. And I also ask their parents, both the parents, in case of a boy, the father can speak well, and in case of girl, the mother can speak well. So I also ask their parents to speak to them and to educate them about the changes that are going to happen in both the girl and the boy's body. It is a natural change and they should know about it. One of my students asked me that his mustache is coming, little beards are coming in his face, so facial hairs are there. And he also said that one girl in his class is having the same problem. So I explained him that both are not same. Your beard, the facial hair is called beard and her is a natural hair. She has it for her hormonal imbalances maybe, or maybe her hair growth is more, so she is having her facial hair. So there is no problem between, there is no similarities between your facial hair and her facial hair. The things are going to change. You may see many things in her body that is changing, and you may also see many changes in your body too. Those changes happen because of your hormones. Your hormones are changing every day, and it is including because it is changing because of your diet, your food habits, your curriculum, your stress, your work, everything is dependent for your changes. So you should understand. I also explained that about periods. Girls will have their periods. So if you see any girl, any stain in their skirt, don't laugh. Help them. If you can help them, if you can take them to the washroom, or if you can ask someone to get a pad. So if you can help them, do help them. Don't laugh. It is a natural thing. And because of these periods only, you people are born. Without this, you people could not have come to this world. So they understood. And now one day he came from the school and he shared with me that one of the girl is having period and she is having pain in her lower abdomen. Then I explained him that yes, it's natural, because when she is having period, there are some blockages or there are some problems that she may have cramps, and this is very normal. Every girl used to have. So he said, she is asking for chocolate. So I had a chocolate in my bag, so I gave her. I said, very good, you did well. So he also asked me if a girl is going through period, why she wants chocolate. I said there are so many mood swings, and chocolates is a happy hormone, so it increases the hormones, and she feels better. I said, okay, every day I will carry one chocolate for one girl. I said, okay. So these are the things. In this way, I used to teach them, I used to educate them that period is a normal thing. And now most of my boys students used to come from this school and used to tell me that, ma'am, today one of my friend is having period, and she told me about her period, and I explained her that you will have this and that, and if you feel any problem, tell me, I'll help you. So I said, very good, you are doing good work. So in this way, I have started an initiative, and if every parents used to talk to their children about these things, then I think the problem, the things, the barrier between a girl and a boy will shrink, and they will open up more. The girl will open more, she will talk to the problems, and she will also understand the things properly. The boy will understand the things properly, and then we can create a healthy society. So talking is very, very important, and especially to the teenagers, because they are very curious to know why the girl is having period, what are the stains, why this, why she is not feeling well, what are the pains she is going through. So if we explain them in a proper way, then one day that boy will become a man, and he will understand the problem of his wife, of his daughter, of his mother, and then he can also educate others, and in this way we can create a healthy society. So we should start initially from the teenagers.
All right, thank you so much. And nowadays, if you look at Netflix shows or any OTT media platforms, they are talking very openly about periods as well. Now, coming back to, we are probably running short of time, so I've got two more very important questions. This question I would have wanted Manju Lodha ji to be present, but sadly she's not here now anymore. But the question was, and she highlighted this, that, you know, to get rid of the sanitary products, we need to create machines, because, you know, with the climate change and global warming, we need to think of, you know, sustainable products which are biodegradable. But at the same time, we're heading back towards, you know, like period panties or reusable pads, which are sort of very similar to using the cloth. The concept is similar. So how do you think, is that going to be, I know it's going to be environment friendly, but how is it going to help with the hygiene? Alka ji, do you want to take this?
Yes, I think like how Rajni ji pointed earlier, that, you know, it used to be cloths, but it was, there wasn't any like soap or washing facilities available. There wasn't any drying facilities available. You know, when you dry clothes under the natural sun and light, or in a dryer now, when we have the washing machines now, we are drying them at a temperature which is lower, but it's kind of helping to reduce the microbial load in there. So to get that, you know, to get that hygiene, we are drying it out. Earlier it used to be, people never used to see that, you know, it had to be in one corner of the house where no one goes, in, you know, in the most dirtiest of places, so that people wouldn't see that. But now if we are using it, we are using it with the awareness that we need to keep it clean. There are protocols now which is sent along with those kind of sanitary products, so everyone knows what temperature they need to be washed at, how many times. Or, you know, people are generally more aware about their own hygiene and cleanliness. So because we are in such a world now where we are, you know, there's a lot of things happening about with climate change and everything, we are going a full circle again. It's a 360-degree flip again, where the pads that are being made are made up of a fiber now, which is more kind of recyclable. So, you know, there's development on that side too. So we shouldn't be feeling guilty, but do what suits us the best. Do what makes you feel comfortable, rather than feeling pressured to use one thing or the other.
Yes, and I actually did read something. It came up on one of the Facebook ads that they have started making flushable pads as well, so which would be good for the environment. Arpita ji or Rajni ji, do you want to add anything to these products?
I think only thing I will add, I think it's important to be aware. Yes, when like throughout our life, when we have gone through quite a lot of changes. Like if I think about my time, I started with like old towels and everything. It was, my mother was quite open, so therefore I was taught. I started my period at the age of 10, and it was a big shock. And then she told me, and I was really frustrated that I have to go through this journey throughout my life. And then my mother reassured me, look, I am going through that as well. And then I used those old clothes and everything, but it was kind of dried up in like proper sunlight, etc. Then gradually went into the college, then all these blue liquid coming out of the sanitary pad, and those things used to come up in the DD channels, and it was kind of very awkward. Like if you are watching those ads at that time, you are supposed to go out of the room because it's looking odd. But then the way I was brought up, yes, I was not aware of on those early days about this sustainability, plastics and everything. And then gradually over the year, when I was hitting my 40s, those things comes up. So we started talking about the sustainable product, recycling and all those things. And then there are sanitary cups or menstrual cups you call, and that is, again, it's your personal choice. If you want to use those non-disposable, recyclable stuff, then do your own search. Or if you want to use menstrual cups, then do your own search, learn about your own body, and choose what is best for you.
Right, thank you. Alka ji, do you have something to say? You have raised your hand.
Yes, I just wanted to make a small point. All these ads, they show that, that the pad is so absorbent, and they just show some milks in a test tube and they pour it and they say, oh, see how it is absorbed, it is all well. Everyone's flow is very different. So don't get, sometimes even the midwives or the nurses you go to speak about will say, oh, don't worry, it's normal. This is not normal. This is, I remember when I had my first, my first child, my delivery, I had told my gynae that, I'm passing clots. And she's like, oh, this is normal. Don't worry. It's not clots. Many ladies have many more than this. So, but then that is what is making me uncomfortable. So it is uncomfortable to me. So that's why we need to be worried about. And if you feel that there is some changes in you, then please make sure you speak to your GP or your doctor or midwives or nurses, whoever you're comfortable with, but make sure you point it out.
And I would add to that because I have been through the system in NHS where I've been pushed and dismissed and everything, I would say keep pushing. And if they refuse the treatment, then say, I want it on my notes, because then they are refusing the treatment. So we would also, I will start with Rajni ji on this thing. We talk about economy. We talk about period poverty, where, certain people cannot afford menstrual hygiene products. In schools, in certain parts of the world, whether it's Africa or, the developing countries, if you talk about South Asia, Nepal, where students, female students or other menstruators are not allowed to go to school because of poor sanitation or whatever other cultural or societal reasons. That also affects on the economy badly, because, you are losing that workforce eventually, and we don't have a lot of, in the UK, we're talking about period leaves now, or, more period friendly workplaces who would, you can actually raise a complaint as well if somebody's being, if you're being discriminated. So how would you talk about, period poverty and economy and hygiene in students?
Yeah, so especially in slum areas, you will see that people are not aware, not ready to use pads, because pads are very costly. They used to come for like 40 rupees or 50 rupees per packet, and for them it is expensive. So for that reason also, many people are not using sanitary pads, and forget about that cups and tampons and other things, because those are more costlier. So it is better to use pads, but that also it should be cheap. So now our government has introduced so many facilities for this girl child in the vernacular mediums, that they are introducing pads. They are giving free pads to the children, girl children, and they are also asking them not to use clothes, as clothes are unhygienic. But what when a girl is having period every month, because that pad is given only for one time, and girl will have period every month, so every month's expenses are there. So my special urge to the government that this sanitary pads the cost of the sanitary pads should be minimized, so that every girl child can have that period and can have a good future. These pads are saving them from disease. So it is very much important to minimize the cost of the pad. Now, if you go to a shop and ask for a sanitary pad, the pad will cost 40 to 50 rupees. Every person who, the person may be a laborer, or a person may be a daily wage worker. So they are not willing to buy that product. Instead, they will buy rice or some other things. So they ask their children, they ask their girl child to use the clothes, and they will say, we are also using it. But if it is made compulsory that every girl child should have pads and the cost can be minimized, then I think it will be a great help for those families. Some are having heavy flows. Sometimes one pad is not enough. We have to take 2-3 packets also. So again, the cost, if you buy 2-3 packets, then it will come up to 150 or 100 or 150 rupees in Indian currency. So it is not possible for everyone to afford. So if it can be minimized, and if it can be bring to 10 to 15 rupees, then I think it will be a great help for those people. And then we can educate them to use those pads. Recently, in the Mother's Day, I took an initiative, and I have gifted 2 packets to 2 ladies. One is a betel nut shopkeeper. She is she has her shop in the roadside, and one is a vegetable vendor. When I talk about the menstrual health and hygiene, she said, I used to use clothes. When I asked her what you give to your daughter, she's a mother of 2 daughters, and when I asked her that what you give to your daughter, she said, we use clothes only because, see, I hardly earn 50 to 70 rupees or 100 rupees or 150 rupees per day. So how I will afford? So then I gifted her, and she became so happy. She said, this month my girl will have a hygienic thing in her wardrobe. So if we can minimize the cost of the pad, then I think this can be a great change for our society. Then many girls, many women will come up and will use the pads, and it will also protect them from many diseases.
Thank you. This morning I saw the video by Inspiring Indian Women where they were giving out sanitary products to girls, and I think that is a great initiative. In the UK, we do have free sanitary products in the universities and certain areas where you can just access them, although in some places you still have to pay for it in the ladies' toilet. But some places have made it free. And I think what Rishi Sunak did in 2021 was amazing by removing the tampon tax, women products, the pink tax that we are aware of. I think it's something that is, we have to pay extra because we are women. And it shouldn't be that way. So do you have anything to add to it, Arpita ji, Alka ji? And then after that, we'll just do our parting thoughts. And if there are any questions in the comments, we'll take those.
Can I just say something? It's not about menstruating or something, but because we've got a women panelist and women audience who might be very listening into this and benefiting from this. I think from 1st April 2000, like this year, from 1st April, people who are on HRT or hormone replacement therapy have got like a prepayment certificate come out. So you just pay £20 a year, but you can get all your medications on repeat prescriptions without having to pay. And that is saving you a lot of money. So something not related, but something for the women. That's why I thought I'll bring it up.
Thank you. Dr. Arpita, do you have anything to say?
I will just say, be aware of your health. If something is bothering, do not suffer in silence. Talk about it. Because I have seen lots of my friends or their children, they have like heavy periods and they're saying, no, it's normal. And I have to tell them, look, this is not normal. Why don't you take your child or yourself, refer to the doctor, because it is important. Because unless you are healthy and happy, you will not be able to give support to the people, those who are dependent on you, or you will not be able to fulfill what you desire to or what you dream about. Similarly, when it comes to menopause, a lot of my friends, they will say, oh, this is normal. I said, look, you have to look after your health, because otherwise you are probably not thinking of a really happy, healthy, active postmenopausal life, which you enjoy, because your period stops. Okay. So you say goodbye to that monthly guest. You just live your life probably as you have lived your life before it starts. So you don't have that worry, oh my God, no, I can't go there because I have heavy period. You have stopped it. So look after your health. If there is any concern, raise it to your GP or specific professionals. Talk to your friends. There are a lot of material available in the internet. Don't rely on Dr. Google too much, but gain knowledge, validate it, and look after your health. That is the only message, and be safe. Whatever step you are taking, find out or ask you why you are doing it. So that in 5 years' time, when you look back, you do not have that thought, I wish I would have done things differently. That is my message. That's all.
Thank you. Harpreet, would you like to add something?
I just want to say that it's all about balance. We've discussed that why we don't talk about menstruation. Should we talk about it with men? Why men don't talk about it? It's all about keeping a balance. And I think it'll really help if, you can just at least talk to your family, be confident and be comfortable. If not to the outside world, at least be comfortable talking to your husband, brother, father. Try and educate your family, and slowly, hopefully, we'll get there. And another thing I want to mention is about mental health. Be kind to each other. Mental health is a very big topic and we are very time bound. We've talked about menopause that has vast effects on, hormonal changes and effects on mental health. Please be kind. I want at least women to be kind to other women. You go into a forum or when you read about menstruation, there are a lot of women who don't support other women. If we want to live in a peaceful world, we need to be kind to each other. And I think we are very lucky, everyone on this forum at least, we are fortunate enough that we have accessibility to all those facilities and products we are talking about. If not, if not much, like Rajni ji, you did a great deed by providing some pads to the vendor. You said if we could do, little kind acts like these, anything to help and support other women, and keeping this going, I think hopefully we'll enter the world we all wish to be in slowly. That's all I want.
Thank you. And, taking a lead from what Rajni ji said about gifting, when we, in the UK, especially when we come out of supermarkets, they have those big boxes over there, which are for, the food supplies, which you can give it, you can buy something for somebody, who needs it. So I think it's very important we can buy sanitary products and leave it there for anyone who needs them. Thank you, Inspiring Indian Women, for providing us this platform. I will end this talk with my point that, it is time to talk about it. to end the stigma. As you talked about mental health, and my mental health had been affected so badly to a point I was suicidal, with ideation and self-harming. And it's not easy being a woman when you're going through so many things. So I blog with the under the title of the Endomentalist. Endo comes from the endometriosis and mentalist because of the mental health. So I think it is very important to talk about mental health as well, which is equally a stigma as much as women's health. So thank you so much for giving us this platform to speak about it openly and bringing, creating awareness and have all the audience to listen to us as well. Thank you. Rajni, over to you.
Yeah, thank you so much, Sana Kadar. In fact, it's been very enlightening and insightful session. And I personally learned so much and from each experience and each knowledge. I would also like to thank Ashok Kumar Chauhan ji for being part of this show and constantly blessing us and helping and supporting in whatever way possible. Thank you, Dr. Arpita Ray. Thank you, Rajni Shah. Thank you, Harpreet Chauhan, Alka Pandey, and Sana Kadar. This is Inspiring Indian Women signing off, and we hope to come back with another topic very soon. Thanks a lot. Goodbye.
Thank you.
Thank you. Thank you,
Thank you.
everyone.
Thank you so much.